everyone. Welcome to today's webinar on reducing problem gambling in Oregon. Roxanne and I are excited to share this project that we worked on with you. My name is Katie Dively, and I'm a research scientist at the Center for Health and Safety Culture at Montana State University. And in that role as a research scientist, I provide a lot of training, and I also guide or provide TA to communities and organizations in their prevention efforts. So my co-presenter today is Roxanne Jones. Roxanne, why don't you introduce yourself?
Great. Thanks, Katie. I'm happy to be here as well. So I'm Roxanne Jones, and I work with the Oregon Health Authority here in Oregon and have done so for the last 5.5 years as the statewide problem gambling prevention and outreach specialist. So I administer our problem gambling prevention program across the state of Oregon and work with our providers providing technical assistance and monitoring the progress that they're making and helping them at the community level.
Cool. Thank you. So before we get started in some of the content, let's take a look at WebEx and make sure that folks can reconnect it if they are being disconnected or anything like that. So we will be recording this webinar, and it will be placed on our YouTube channel later on. Just a good tip, you might want to check out our YouTube channel because we do have quite a number of videos and pre-recorded webinars there, so take a look. If for some reason you do lose audio connection, you can click on that little phone icon at the bottom of your screen, and it will provide you with a couple of options for reconnecting. Also, if you want to make a comment or ask a question, you can do so by opening the little chat window, and you can reach us that way. We will have an opportunity at the end for some questions, so we may, if we're not able to answer the questions as we go along, we may wait till the end to answer some of those. But please feel free to send those in. So now a little bit about the Center for Health and Safety Culture. Like I said, we are located at Montana State University, which is in Bozeman. We are an interdisciplinary center that serves communities and organizations through research, training, and then guidance to cultivate healthy and safe cultures. So these are the core issues that we address at the center: traffic safety, the misuse of substances, domestic violence, and also child well-being. And as you'll hear today, we definitely work on other areas of health and safety as well, such as the prevention of problem gambling, which is the focus of our webinar today. So what I'd like to do to start is I want to have Roxanne talk a little bit about what brought us together, kind of how this relationship formed. And then we'll talk about problem gambling and the concerns around gambling in Oregon. Then we'll talk about a cultural assessment that helped us understand what was really taking place in Oregon among adults and also youth. We'll describe a toolkit of resources that was developed to address problem gambling across the state. Well, then we'll talk about, once we have these resources, we need to build the capacity of the prevention specialists to use those resources. So what that looked like, and then also describe briefly, what does the future hold? What does this look like as we move forward? So with that, that overview of our agenda, Roxanne, I'm going to hand this over to you now. Would you describe, what brought us together and then take it from there?
Sure, I'm happy to do so. So what brought us together was that the Center for Health and Safety Culture was partnering with the Oregon Health Authority to develop some resources to support our prevention efforts here in Oregon to reduce teenage alcohol use. And I had the opportunity to attend a couple of trainings when they were rolling out the tools and discussing them that had been developed for that teen alcohol use reduction campaign, and I became intrigued about the potential opportunity of developing some resources utilizing the framework for our problem gambling prevention professionals here in Oregon. Then one of our providers was hosting a training on the positive culture framework, so I went ahead and attended that, and Katie was presenting there, providing a great wealth of information on the positive cultural framework and how to utilize it. And I started thinking about exploring potential options to enhance our problem gambling prevention efforts here in Oregon. Made that connection with Katie there, and we started to have the conversation about partnering to develop a communication campaign to reduce problem gambling among Oregon youth and adults. And the rest of the story we're going to be sharing with you here today. So next slide. So the purpose of our project was to utilize the 7-step communication process of the positive cultural framework to create a toolkit aimed at increasing the protective beliefs and behaviors of Oregon youth and adults to reduce problem gambling. So that's the project we came up with, and we started moving forward and working on over a period of time together. So next slide, Katie. So one of the first things we did was we knew that we're concerned about gambling here in Oregon because we know that gambling is an activity that carries risk, and that our research showed that many adults in Oregon, 65%, have participated in some form of gambling in the past 12 months, and that over 84,000 of Oregon adults are estimated to meet the clinical diagnosis for a gambling disorder. So we knew that there was a concern. Next slide, please. We're also concerned about youth. We didn't want to leave them out. And while it's illegal to gamble before the age of 18 or 21 here in Oregon, depending on the setting, we know that some of our youth are. So we know that over 5,800 Oregon youth are considered at risk or are already engaging in problem gambling behaviors. And our Oregon 11th graders who reported they were gambling at higher rates if they were skipping school, being in physical fights, had reported being sad for 2 or more weeks, and were using alcohol and marijuana or other drugs. And so there was a relationship between the other risky behaviors they were engaged in as well as their gambling behavior. Next slide, please. So again, with the concerns, we also know that problem gambling ties into other health concerns. Problem gambling is more common in those with alcohol use disorders, drug use disorders, and other behavioral problems. Problem gambling is also more prevalent among those with nicotine dependence. So our folks out there utilizing tobacco products. People with gambling problems are twice as likely to be depressed and 18 times more likely to experience severe psychological distress than people without a problem with gambling. And then the suicidal ideation is more prevalent among those with problem gambling than the general population. So we see that the concern is there, that it ties into other behavioral health concerns as well. So while there's a lot of concern about problem gambling, we also know that it can be prevented, and we play a role in that prevention effort. So the concerns highlighted in our research provided the backdrop for the why. Why is this work important, and why are we going to move forward in Oregon to develop this campaign? So next slide. So there's a growing amount of research done on gambling behaviors, and recent surveys of Oregon adults and youth revealed important positive beliefs and behaviors about gambling. The data shows that Oregon is in a place that supports addressing this issue. We have much to build on and to work to prevent problem gambling here in Oregon. So go ahead, next slide. So it's worth saying again, problem gambling is preventable, and we're fortunate to have some free resources here in Oregon for all Oregonians, which include prevention services, intervention, and treatment options. We have a robust prevention and outreach program across the state, a 24-hour helpline, intervention through phone counseling, some crisis respite care, outpatient, individual, group, and family counseling, as well as we also have an inpatient program for our individuals who are needing that type of service. And it's important to note for us here in Oregon, treatment is available for all Oregonians experiencing problems with gambling. So I shared with you some of the concerns about gambling, and equally important is raising is raising hope. We need to grow the concern without creating fear, which can paralyze people from taking action, and we don't want to do that. And importantly, it's also important to raise hope. So concern grows engagement and conversation, where hope helps provide us the path forward toward change. And so this is the basis behind the program that we developed here.
Yeah, thanks so much. That's a great foundation and backdrop for why we kind of entered this project together. And so now let's talk a little bit about kind of what we did and how we did it. The work of preventing problem gambling is all about behavior change, and we wanted to be very clear. It's not that we're trying to prevent gambling. We're trying to prevent problem gambling, and we wanted to be sure that that was clear and apparent in this project. And what we focused in on was trying to grow protective behaviors, like having guidelines for responsible gambling, or knowing the warning signs of problem gambling, or accessing resources if necessary to prevent problem gambling. So those were the behaviors that we were trying to grow. To do that, to change behavior, we really need to look at what's driving behaviors in the first place. So what you see here is a simplified version of a behavior model. It helps us understand what's driving the behaviors that we want to grow. So on the right-hand side of the model, you're going to see that willingness and intention are predictive of behaviors. But what makes somebody willing or have the intention of engaging in a behavior? And let's just say like accessing resources. Well, it's their attitudes and their beliefs about that behavior, such as accessing resources. So what are my attitudes about accessing resources? What do I believe is going to happen if I access resources? And there are multiple different types of beliefs that we focus in on here. It's not just one. We look at, behavioral beliefs and normative beliefs and our control beliefs. All of those play a role in driving our behaviors. And I'm not going to go into any detail on that, but I just wanted to let you see that it is more complex than just one belief that's driving our behavior to do something. But you might be asking, what's driving our attitudes and beliefs about a particular behavior? Well, we find that that's their value system. And while a value system isn't specific to a behavior, like I don't have a value system around accessing resources, it's pretty broad in nature, and it can take a long time to shift. But these values are important. They provide the foundation from which we develop these attitudes and beliefs about specific behaviors. So where do these attitudes and these values, attitudes and beliefs come from? Well, research tells us that they come from our culture. So our culture is playing a significant role in our behaviors. So let's talk about culture for a minute here. Our culture is the shared values and beliefs of a group of people that influence behaviors. So there are many definitions of culture. This is one that we work on at the center. And a couple of important bits of information here that I want to point out. One is that it's the shared values and beliefs. That means, it's not just one person that has these values and these beliefs, or two people. It's most people. And it's most of the group. And the group of people we can define in a number of different ways. It can be, geographically, like for this project, we worked in the state of Oregon. We could group people by age or ethnicity, or even, within organizations, because we know that there's different organizational culture. But again, it's the shared values and beliefs of a group of people that influence behaviors. So it becomes really important for us to start to understand what the current culture is, so that we're making decisions based on the actual culture, not just what we believe or perceive to be going on. So at the beginning of the project, Roxanne and her team provided us with some pretty awesome sources of data that helped us understand what was currently taking place, not only among adults in Oregon, but also with youth as well. And we found that we still needed to gather a bit more information on the current values, attitudes, and beliefs so that we could start to shift behaviors towards more positive and protective behaviors to prevent problem gambling. So to do that, we engaged in 2 different online surveys this past winter. One was on the shared values, attitudes, and beliefs that impact gambling behavior, and the other was assessing guidelines for responsible gambling. what we really wanted to know was, how concerned are people about problem gambling behaviors? To what degree do people have perceived stigma about problem gambling, and how does that correlate with their beliefs and their behaviors? Are people in situations to intervene with a problem gambling? And if so, how often do people in that situation actually intervene? What are the attitudes and beliefs that predict accessing the Oregon problem gambling resource? And how much do people agree with using guidelines for responsible gambling? So that's what we really wanted to know. But what's next, right? So we've collected the data that helps us understand what's driving behavior, but what do we do? Well, that's where the toolkit comes in. We've created a bunch of different tools, and if we follow that behavioral model that I introduced earlier, we know that if we shift beliefs, we can impact behavior. So that's really where we want to focus in on those beliefs, right? So we wanted to create tools that were strategies or different experiences that were designed to change beliefs. Specifically, we wanted to grow these beliefs. This is what we saw in the survey. We saw that most, or 87%, of Oregon adults agree that if people choose to gamble, they should have gambling guidelines for doing so responsibly. Most, or 73%, of Oregon adults would want somebody to intervene if they had a problem with gambling. Most, or 78%, of Oregon adults believe that trying to get help for someone who has a gambling problem is the right thing to do. And most, 76%, of Oregon adults agree that people under the age of 21 should not gamble, or that legal age, as Roxanne mentioned. So as you can see here, there is a lot of hope in Oregon, and there are strong protective beliefs. And we also have room to grow here. So our work became, developing tools and to continue to build on and grow these protective beliefs so that we can prevent problem gambling. So the positive culture framework, which is developed by the center, as you can see here, is the framework that we use to build the tools. As you can see on the right-hand side, you can see an upward pointing green arrow. It's an appreciative approach. We're looking at what we want to grow. We're looking at growing protection here, growing positive beliefs and behaviors to improve health and safety. And in this case, we're working to grow those protective beliefs that you just saw in order to grow more protective behaviors relating to preventing problem gambling. On the left-hand side of the model, it shows in blue around the circle there, it shows a 7-step process for doing the work to grow more protective beliefs in the behaviors. It shows 3 skills around the outside of that circle that help us be more effective, which are, leadership, prevention communication, and also the integration of strategies. And also the context for doing the work, which is the social ecology that you can see in the middle of that circle. Now, the social ecology describes different layers of social influence or environments within our communities or within our organizations that impact our beliefs. So, for example, if we're the individual, our families and our peers influence what we believe and how we behave. Our work sites do, or if we're a young person, our schools influence our beliefs and our behaviors. And the communities that we all belong to play a role in shaping our beliefs and therefore our behaviors. So I wanted to introduce that sort of on purpose, and I am going to bring it up again in just a little bit when we specifically talk about the tools. So I don't have time to go into depth here at all on the framework, but I do want you to know that we have a couple of pre-recorded webinars on the framework on our website and a couple of other tools if you are interested in looking to use that framework to improve health and safety. So we developed a toolkit to grow those beliefs that I was mentioning earlier. And so we called it the Oregon Problem Gambling Prevention Project Toolkit. And the purpose was to support prevention coordinators across the state. It was to support their efforts to engage others in preventing problem gambling in Oregon. And we did that with 2 goals in mind. One was to promote the development of responsible gambling guidelines. And the other was to encourage people to be a support or a resource for someone that they're concerned about or for themselves as well, right? So to either be a support for someone whose behavior is concerning, but also to access resources on their own. So I mentioned earlier that this social ecological model. And if we come back to the purpose of the toolkit, it was again to support the prevention coordinator's efforts to engage others in preventing problem gambling. Now that's important. Their work was to engage multiple levels of the social ecological model rather than only working with, let's say, like, adults in Oregon. Because when we start to do this, when we start to engage in different strategies across those different social environments, that's when we have a cultural approach, one that starts to shift beliefs across these very influential systems, which is much more likely to be sustained long term. So, this is the brand or the theme that was developed as part of these tools: reflect, resource, renew. And it really tied all the toolkit pieces together, as you'll see. And these words had special meaning for us, and they capture 3 steps that we can use to promote and to promote the tools and to prevent problem gambling. So let's discuss what those words mean. So first, we're asking people to reflect. And perhaps it's reflecting on how gambling is impacting their life or even the life of someone else around them. Reflection can be about thinking about, what is my current level of knowledge around the risks associated with gambling or symptoms of problem gambling? What do I know? Maybe it's reflecting on whether or not they have guidelines for responsible gambling or a family rule about not gambling before the age of 21. So reflection became that really important first step in preventing problem gambling, and we wanted to draw attention to it. The second step there is resource. So if through reflection someone discovers that they need more information or more support, that there were resources available for Oregonians through the Oregon Problem Gambling Resource. So there are resources available in terms of just getting more information about problem gambling, or also for individuals who are interested in getting help for their own gambling behavior or someone else that they're concerned about, like a family member or a friend. And resource also encourages people to be that resource for someone, right? For either themselves or for someone, by understanding what those risks are associated with gambling or those warning signs. The third step is renew. And this is all about hope. Roxanne described how important hope was. So if action is taken by reflecting on gambling behaviors and then accessing resources, if necessary, to engage with services or to engage with others, then the renewal of lives and families and relationships is possible. As Roxanne mentioned, problem gambling can be prevented and treatment is available. So we really wanted people to understand these 3 steps as an important part of their work. And again, you'll see them reflected on each and every piece. So the toolkit has 3 specific sections in it that I do want to touch on here. The first is raising concern and hope about problem gambling in the state. And as Roxanne mentioned, we raise concern so that people are aware that this is an issue, and also so that they can feel the need to further engage on it. And when we provide hope, that's when they start to see that path forward towards change. If we just raise concern and we don't also raise hope, people can get stuck and sort of not know where to go. The second section is the role of the prevention specialists. And the third was to use the tools that were available to them. So let's start to take a look at section 1. So these tools help the coordinators raise concern about problem gambling throughout the state, but also raise hope that there are protective beliefs and behaviors and resources available if necessary. So the tools came in the form of press releases, PowerPoint presentations, speaking points, or even kind of longer quick talks or elevator speeches for when you're in an elevator with someone or perhaps in the line at the grocery store. And then finally, media that could be placed. The second section, again, was their role, and that consisted of 4 tasks. So we wanted the prevention coordinators to learn more about the project's goals, that brand of Reflect, Resource, Renew, and also the positive culture framework, which is the foundation for the development of these pieces. We wanted them to identify opportunities to engage with others across the social ecology. We wanted them to see how they could integrate problem gambling prevention with their other prevention efforts, understanding that these prevention coordinators across the state were doing multiple other things on a variety of issues. And so that problem gambling didn't need to be a completely different task, but it could be integrated into their other prevention efforts. And then the fourth role was to use the tools and resources that were provided in the toolkit. So let's talk about what some of those tools and resources are. So a couple of things that they received was, as I mentioned earlier, press releases to announce the project, speaking points that could help them just really succinctly capture the concern and the hope across the state, quick talks if they wanted a little bit longer of a conversation, a public presentation that they could go out and deliver to adults across the state. Also, a workshop presentation for professionals. So this was a 1-hour workshop with a little bit more detailed information that they could go out and deliver to a variety of different groups. There was a series of 6 stigma videos available that introduced stigma, defined stigma, discussed what factors contribute to stigma, and then also ways to address it, because we know how stigma is related to help-seeking behaviors. And then also the key findings report from the data that was collected across the state. Also provided was different media. So there was a 60-second video that was developed, and you'll see that in just a second. A shortened version of that, which was a 15-second version. So these videos could be played, of course, on television. They could be played on the internet or before a meeting started, but just a tool to convey some of these important steps. There were 2 radio ads developed that could be placed. There was a rack card, which you actually see here in a picture. And that rack card, is something that you can put in a holder on a counter, maybe in an office building, or you can take it to a health fair, or you can distribute it to somebody. But it did have a couple of key messages, as well as those responsible gambling guidelines. And then there were 4 posters that were developed as part of this project. So what I'll do now is I will show you that 60-second video that was developed as part of this project.
Do you have responsible gambling guidelines?
Gambling can be fun, but it can interfere with your relationships, can lead to feelings of guilt or more serious issues like not being able to pay your bills and feelings of depression or anxiety.
In Oregon, most adults, 87%, agree that if people choose to gamble, they should have their own guidelines for gambling responsibly. Guidelines like,
I always limit how much I spend.
I don't try to win back my losses.
I avoid drinking alcohol when I gamble.
check out the Oregon Problem Gambling resource to learn about how you can establish your own guidelines for responsible gambling.
If you're concerned about your own
or someone else's gambling,
opgr.org has free confidential resources.
Problem gambling is preventable. Renew your commitment to gamble responsibly and establish guidelines.
Reflect,
resource,
renew.
Visit opgr.org for more information.
So that was one of the pieces of media, the 60-second video that was developed. And again, we were encouraging folks to be playing that as they could online, maybe on their social media pages, perhaps also before meetings got started, just to start to encourage people to consider the resources that were available, including OPGR, responsible gambling guidelines, tips for developing those, and so forth. And of course, there was also a 15-second version of that as well. Okay. So these are, give me just a second. You'll also see here a few different posters that were developed. In this first one on the left, we have a normative message that, people wanted someone to intervene if they had a problem with gambling, sort of giving the public the permission to intervene. Most of us do want somebody to intervene if we have a problem. This middle poster was one of a couple that reflected the guidelines for responsible gambling. And on the right here, you can see a poster conveying that normative message that most Oregon high school students don't gamble. Additional tools and resources that were provided as part of this toolkit were media placement guidance, so helping coordinators start to see some ways that they could possibly place these different pieces of media that I just showed you. Also an activity for them to start to inventory different media outlets that were available to them. The social media guidance was a guide that provided them sample tweets and Facebook posts and emails that they could send out that they could actually just cut and paste to use to get out information about preventing problem gambling. There was a process for them to start to engage stakeholders across the social ecology. And then also, so much of this is meeting with groups and facilitating conversation. So there was a tip sheet there on how to do that. So while developing tools is important, and while getting those tools out to the hands of the coordinators is also very important, it's not as good as when we get it out there and also develop the capacity of those coordinators to use those tools. So we could have handed them over and let them go, or we could have handed them over and tried to grow the capacity of these professionals so that they felt more comfortable and confident in using these tools across the state. So Roxanne, do you want to tell us a little bit about how we grew the capacity of the prevention coordinators?
Yeah, sure, Katie, thanks. So we definitely wanted to make sure that our Oregon prevention professionals definitely had that capacity to implement the toolkit. And then we also wanted to make sure that our key stakeholders along the way were also informed. So the Oregon Health Authority, along with the center, hosted quarterly webinars providing education on topics such as the positive cultural framework, stigma, bystander engagement, just to name a few. And then additionally, from the results that Katie shared earlier about the 2 surveys, we also wanted to make sure that our providers were seeing that information, as well as our stakeholders along the way as well. So we included those in the webinars too, to make sure that those key findings were being talked to and shared with our folks during the time frame of developing the toolkit. Then, once the toolkit was developed, it was time to roll it out. So we did that in an on-site training here in Oregon back in April of this year, where we had our Oregon prevention professionals as well as some key stakeholders come to the table. Katie actually came out and spent the day with us and our team of Oregon folks here, sharing the background on the project, and then rolling out the toolkit. And leading discussions on how our providers could engage with the toolkit, develop local communication plans that would tie into their individual biennial implementation plans that they had for implementing their problem gambling prevention work across their community. That would lead toward increasing awareness that gambling is an activity that carries risk. And that, always keeping in mind that problem gambling is preventable and that there are resources available. So we really worked together during the time frame of when the toolkit was being developed and then rolling it out to make sure that we brought our providers and our key stakeholders along with us for this journey so that the capacity would be building along the way. One of the other things we took a look at in capacity building was also ensuring that all of our providers at the local level were familiar with how the helpline worked here in Oregon, what it would feel like if they contacted the helpline. So again, just making sure that capacity was there.
Awesome. Thanks for that. That is such an important part, I think, of the work is continuing to build the capacity of the leaders to use the tools that were developed. And then tell us a little bit, Roxanne, about what you see as the future for this work.
We're really, really excited as we roll out this toolkit, and the feedback have come in from our Oregon prevention professionals has been really very positive. And so they're currently working toward increasing their community's overall community readiness to address problem gambling. And so they'll be rolling out this toolkit statewide based upon individual communication plans that they're developing to support the work that they're doing at the community level. They're also currently applying for some additional funding from our program here at the Oregon Health Authority with Problem Gambling Services to support their proposed communication plan, because we really wanted to make sure that as we develop these tools that they also had the resources, not just the knowledge resources, but the funding resources as well, to be able to utilize them at the community level. Though an emphasis on the tools was also things that could just be ready, set, go, take out into the community and use, that wouldn't require a lot of additional resources beyond the FTE that the providers are bringing to the table. One of the things also for our future is our primary evaluation tool that we'll be utilizing to determine the effectiveness of the efforts of this prevention campaign. Is we're utilizing the community readiness model from Colorado State University. So our providers, we've had one cohort go through already who have completed a community readiness assessment on their community, and we're starting cohort number 2 this fall, to where we will have all of our Oregon prevention professionals will have completed a community readiness assessment, and they will be able to then go back after they've utilized the tools from the toolkit, as well as other efforts that they are implementing at the community level, and evaluate their progress in increasing awareness that gambling is an activity that carries risk, and that resources are available.
That's awesome. What a great future ahead for, not only for the prevention specialists and the opportunities ahead for them, but also the people of Oregon. So, with that, Roxanne, I have so appreciated our work together on this project, and thank you for being here with me today to share that with others. Before I move forward in talking a little bit about the center's resources that are available, I do want to pause here and see if anybody has questions for either myself or Roxanne on this project. And if you do have questions, you are welcome to put them in the chat window or in the question and answer window. You can also we can unmute you and you can ask a question that way. So whatever you're most comfortable doing. And we haven't had any questions that have come in while we were providing the webinar. And on the last slide, we will actually provide you with our contact information for the center. So if you do have questions after you leave the webinar, you can certainly pose them at that point, and we will get back to you. So I think since none have come in yet, we will I'll continue to go on throughout and provide a couple of resources that we have through the Center for Health and Safety Culture aside from this project. So we mentioned that the foundation of the work to build the toolkit for problem gambling prevention in the state of Oregon was the positive culture framework. And we do have a training coming up. If folks are interested in learning more about the framework to improve health and safety, they can certainly join us in Nashville. I'll be providing that training on September 24th through the 26th. So that will be fun. Registration closes September 9th. So if you are thinking about that, go ahead and take a look at our website. We have our website at the bottom of each of these slides here. So check that out if you are interested in learning more about that foundational piece for improving health and safety. We also have trainings, beyond the positive culture framework. We also have trainings in a variety of different things, including those 3 key skills that are so important to build to support our effectiveness at implementing the framework, and those are our communication skills. So we provide 1 or 2 day trainings on communications, in particular social norms marketing. We also provide leadership skills training, right? Prevention is an act of leadership, and we want to grow and hone those skills over time. We also provide training and integration, and that means, we understand that it's not just one strategy that's going to effectively solve, problem gambling or the misuse of substances or child maltreatment. It's a variety of strategies, and integration is the skill of managing that portfolio of strategies that you're engaged in. On our website, we also have brief spotlight videos that you can take a look at. Now, these are short, 10 to 20-minute videos that really highlight a variety of different things. So feel free to check those out. We have guide service available to people who have gone through one of our trainings, and I suspect if you're like me, you've left a training and you've thought, you've gotten back to your desk and you're sitting there and you're thinking, wow, that was awesome, but how do I do it again? The real life of that can become tricky or challenging. So this guide service provides ongoing technical support as you engage in implementation of the framework at the local level. So consider that. That's always available. We also have a variety of assessments and surveys and evaluation tools that you can consider. And so again, just contact us and you can learn more. And I mentioned earlier that we do have free webinars. So we provide regular free webinars that you can listen in on, and you can subscribe, to our page, and we'll send you notifications about that. But we also record them and place them on our YouTube channel later. So a couple of the ones that we've done in the past are listed here, so you can take a look at those. There are certainly more as well, but do know that you can contact us at any time, if you want to learn more or engage in a training, or of course, if you have any questions that have come up about today's webinar. So I don't yet see any questions that have come up. So with that, I'll thank you all for joining us today on our webinar to prevent problem gambling across the state of Oregon. I hope you all have a good day. Thanks so much.